Hello guys, welcome back to this channel. If it's your first time seeing this bold, beautiful girl, my name is 𝐒𝐿𝐴. I'm a public health officer and I have done other videos. Make sure that you check them out and subscribe to this channel. Make sure that you like our content. And today we are going to tackle the viral STIs. The other time we tackled the bacterial and today we're going to tackle the viral. So without further ado, let's get into the video. Examples of the viral STIs: we have HIV, we have human papillomavirus, and then we have herpes. So we are going to start with the most common, which is HIV and AIDS. HIV is caused by a virus which is known as human immunodeficiency virus. So you get it when you have unprotected sex with someone who's infected with HIV. Also, mother to child during childbirth. You can also, in exchange of body fluids, in terms of maybe having blood transfusion, you can get, if you get blood from someone who's infected, you definitely can get that disease. Of course, if you share needles, sharp items, you definitely are going to get, but not fluids like sweat or sharing utensils. You definitely are not going to get that. So HIV and AIDS progresses in different stages, and of course we're going to start with the primary stage. In the primary stage, you might notice the symptoms. They are quite mild. You might get maybe a flu-like feeling, like you're having a flu, or tiredness, you get tired, you get a sore throat, fever, general body weakness. And then it progresses to the latent stage. That is the stage where you have no symptoms and you might be able to live normally, and for years. It goes for many years, up to around more than 10 years. After the latent stage, it goes to the asymptomatic stage. It is where the viruses have already destroyed the immune system, the white blood cells. Now you have diseases. You have diseases like opportunistic diseases like tuberculosis, pneumonia, and you might have other symptoms like fever, sore throat, swelling of the lymph nodes. Then after that, it progresses to the progression to AIDS. That is, if you're not getting any treatment, it progresses to now the disease, which is HIV and AIDS. And at this point, you have already, your body is definitely weak. You have diseases, opportunistic diseases. You're prone to getting diseases. You might maybe get well after some time, but you get different diseases different times. That is because you're definitely, your body is weak. On management of HIV and AIDS, it definitely does not have any cure, but we have medicines that help the white blood cells fight against diseases. So if you take these medicines diligently each and every single day, they improve your immune system. You can be able to live for a very long time, up to a point where you can go and get tested and find that you don't test positive anymore, because the disease has been brought into a very minimal. It is very minimal in your blood. So on the prevention, we definitely use protection when having sexual intercourse, or if you have been exposed to any type. If you're going to be exposed, make sure that you take medication, or if you've already been exposed, there are definitely medication for that. Or if you're living with someone who is infected with HIV and AIDS, you definitely can also get medications to prevent you from getting that. For mother to child, also make sure that you are tested before you proceed with childbirth. Sorry. Also, avoid sharing needles, in case any needles, sharp objects, and body fluids, of course. And when you are going for blood transfusion, make sure that you don't give blood if you're infected. Or of course, hospitals check if blood is infected before they give you. So the second one we're going to talk about is herpes. It is caused by a virus known as herpes simplex virus. There are two different types. We have the one that is known as cold sores and the one that is genital sores. The cold sores, of course, you can get sores when you're in the mouth, in the sore throat, in the throat. That is why we call it sore throat. And then also the genitals, that means you get lesions in the inner genital area. Of course, you can also get it. You get it if you have sex with an infected person, unprotected sex. And also if you have skin-to-skin contact with someone who has it, you might get it. So it rarely transmits from mother to child. And for the symptoms, they are very mild. Of course, you may not notice them. It depends from one person to another, but symptoms may look like you have sores, definitely sores on your genital area, on your mouth, on your sore throat, or in your mucous membrane for the ladies in the vagina. Also, you might have fever, you might have itchiness, discomfort around your genitals. You might have discharge. For the ladies, you might have unusual, abnormal, or maybe discharge that is more than normal. For the male, of course, discharge will be a bit more, or maybe not more. For the male, you have discharge that is unusual, that is either yellow or greenish or something of that sort, that is not normal. Of course, you might have some pain when urinating. Also, burning sensation when urinating. These are signs that you should look out for. For the treatment, you're going to get antiviruses. Make sure that you visit your doctor to be able to prescribe for you the correct antivirus. The third one, we're going to talk about the human papillomavirus. Of course, it is caused by the human papillomavirus, HPV, and it is transmitted from one person to another through sexual intercourse, also from skin to skin sometimes that happens, but rarely from mother to child. Also, it presents itself with warts. Warts are something like sores or lesions that look like cauliflower. They're ingrowns. They might be, you might see them in the genitals, in your hands, or depending on what type of HPV you have, because we have very many types, over 100 types of HPV. So for the symptoms, you definitely are going to get lesions. You're going to get something like lesions. Lesions need vidonda, whitish. They have like pus on your genitals, on your hands, on your mouth, on your mucous membrane, vaginal mucous membrane. So this is the main symptom that majorly is specific to the human papillomavirus. You get warts. We call them warts because they are like ingrowns in your body. Yeah, so that is the major thing that you know that you have that. Besides, you might have other symptoms like maybe discharges or maybe itchiness of discomfort, but majorly the warts. For the treatment, of course, we've said that there's no treatment, but of course the antivirus is going to help you in treating them, in reducing the virus or the viral load. That we also have, make sure that you go, for those who are children who are still in school, make sure that you have that vaccine that helps in prevention of the HPV. I'm sure that you've heard of it. Make sure that you also take that one to be able to prevent yourself from it. For the general prevention of STIs and STDs, make sure that you use protection when you're having sexual intercourse. That is condom and dental dams. Make sure that if you're monogamous, make sure that you and your partner go get checked. Also, make sure that you visit your clinic once in a year. Schedule a gynecologist meeting to make sure that you get screening for whatever that you might have, maybe a disease or something. Or for the management, make sure that health education is important. Make sure that you talk to your friends, have knowledge yourself and also others to have more knowledge on STIs and STDs in general. For the management, make sure that you schedule screening with your gyna to make sure that you are properly checked. Also for the pregnant women, make sure that you get checked before you give birth. Also for those who have HIV and AIDS or any kind of disease, make sure that you take your medication. And if you've reached this far at this point of the video, thank you so much for watching the video. Make sure that you subscribe to this channel. Make sure that you like this content. Make sure that you comment, ask us any questions that you want. Also suggest which kind of videos that you'd like to see in this channel.